My name is Berks County Commissioner Christian Leinbach, and I want to welcome everyone to another Berks County Commissioners Weekly Update. With a lot of discussion and issues around vaccine hesitancy, we thought that this week it would be a great focus on a discussion with our local medical professionals as well as local religious leaders on issues surrounding vaccine hesitancy and what they have to say to their patients, to folks in their congregations about the importance of the vaccine. Before we get into the program, I would like to note that we are broadcasting live through Microsoft Teams live event, and we are also broadcasting on BCTV, Facebook, and YouTube Live. At this time, I'd like to recognize my executive assistant, Mary Buer.
Thank you. Comments or questions must be germane to the topic being discussed and include your full name and municipality where you reside. If you are from the media, please put your name and who you are with. Non-media participants, please limit your questions and comments to one per person.
Thank you very much, Mary. As noted, this is an important topic. It seems like a short time ago, maybe within the last 4 to 6 weeks, the issue was, where do I get a vaccine? Now pretty much across the Commonwealth, there's more than enough vaccine, and in many cases, concerns, hesitancy on the part of some people in the public to get a vaccination. Well, that's what we're going to be talking about today. We have a great lineup. I'll introduce them in a minute. But before that, I'd like to recognize my colleagues, and we'll begin with some opening comments from Commissioner Michael Rivera.
Thank you, Commissioner Leinbach, and welcome to everyone who's watching this program here today, and also welcome to our esteemed panelists from the Berks Community Health Center, as well as the pastors that are here for joining us today. Thank you very much for joining us. Looking into different research that has been done and in different places, it shows that people won't listen. I don't like to say politicians, I prefer elected officials, but people won't listen to elected officials in reference as to what they should or shouldn't do with their health, but rather they will listen to their doctors or other health professionals and the religious leaders as well. So thank you for being on the show here today and sharing information, answering questions, and sharing your own experiences as well in reference to the COVID vaccination. Thank you, and I look forward to this show and learning a lot from you today.
Thank you, Commissioner Rivera, and we'll turn to Commissioner Kevin Barnhart.
Thank you, Commissioner Leinbach. I too would like to thank our viewers for participating, and especially our influential team of people that have been assembled today. You are basically very much the spokespersons in your communities. And I just want to re-emphasize, we're going to talk about vaccines today, but let's not lose sight of doyourpartberks.com. Let's continue to do our part, masking where it's necessary, washing our hands, distancing as much as possible, but also testing. You have symptoms, let's continue to get tested. Let's comply with the contact tracing efforts by Cook County Wellness. We're not completely out of this yet. We're very encouraged, but there are still, 3 legs to the stool: testing, tracing, and of course the vaccine. So thank you, and look forward to a great dialogue this afternoon. Thank you.
Thank you very much, Commissioner Barnhart. We have a great panel of community leaders, both in the medical field as well as some local religious leaders. And we didn't exactly plan it this way, but there's 3 and 3. So we have both, not sides, because we're in this together, but both groups equally represented. I'm going to take a minute to introduce each of our panelists. First of all, we have Dr. Akama Joy. She is a physician site director for the Berks Community Health Center. Also, we have Erin Cherico, a CRNP pediatric nurse practitioner with Berks Community Health Center, and Jeannie Stephen, a CRNP family nurse practitioner, also with Berks Community Health Center. And then our 3 religious leaders, We have Pastor Ibrahim Bangora. He is the executive pastor at Spring Valley Church of God, and I believe you're also the chaplain at Albright College. That's where you and I first met. Not that I was a college student. I spoke on recently on one of the programs that Pastor Eby led. We also have Pastor Delphine Allen with us, and she is the administrative pastor at Spring Valley Church of God. And then finally, the Reverend Nicholas Camacho. He is a retired United Methodist pastor, I believe most recently West Lawn United Methodist Church, and retired U.S. Army chaplain and coordinator chaplain for the Reading Police Department. Before we go into some questions, I'm going to ask Stephanie Weaver, our public relations officer, to post up a graphic. I think everyone is fairly aware that a couple of weeks ago, the governor of Pennsylvania made a note to all of the counties that when Pennsylvania meets 70% of the population 18 years on up that are eligible for vaccine to be fully vaccinated, the mask mandate will be lifted. We know, and I don't want to get into the conflict, CDC further complicated that with their directive last week on people that are vaccinated not wearing masks. We're not focused on that. We are focused on this slide. And I want to note there's two important numbers. The 38.1% number represents everyone in Berks County in that eligible group that is fully vaccinated. And very simply, that means you, whether you had Moderna and Pfizer, which is a 2-dose, that you are at least 2 weeks past your second dose. And if you are like myself, where you had the J&J, you're at least 2 weeks past a receipt of the single J&J dose. If we look at people that have had at least the first dose, we're at 53.2%, but we need to get to the 70%. And you can look a little bit at the math. We have quite a ways to go in order to hit that 70% mark. I do want to reiterate, as we understand the governor's directive, it's when the state, on a cumulative basis, reaches 70%. So with that as the baseline, I'd like to open it up, and we'll start with Dr. Joy with the question. We have a good idea of the percentage of people, but what vaccines are available locally, and where can residents go to get the COVID-19 vaccine?
Thank you so much, Commissioner Leinbach, for the introduction and the opportunity to speak with you all today. First of all, as you mentioned, the Moderna vaccine is available along with the Pfizer vaccine, both of which are 2-dose series. The Moderna is separated by 4 weeks and the Pfizer by 3 weeks. The Janssen vaccine is also available, and that is a single-dose vaccine. All 3 vaccines are available in various places throughout the county. And if you go to the website that you mentioned earlier, Do Your Part Berks, that does provide all the local areas where you can get vaccinated. Fortunately, recently in the last couple weeks, the Berks Cares COVID Vaccine Center has opened right up 5th Street Highway next to Temple Walmart, and that will help continue to allow opportunities for patients or community members in the area to get vaccinated. But both Tower Health, Penn State Health St. Joseph's also has sites that are open for vaccines. Several of the local pharmacies have sites that are open for vaccines. In addition to what I've mentioned, downtown at 6th and Walnut, Penn State Health's downtown campus has a walk-in vaccination available on Wednesday afternoons for the population that may be closer in town. So fortunately, we have all these centers that are up and running, and then several other local opportunities that are popping up week by week. We've seen Shillington have opportunities at the local high school, as well as Wyomissing and some of the other places. So the website is an excellent resource. That's where I went to sign up my own children. So I would encourage people to use that. Another center, Vaccinate Lancaster, out at Park City Mall, where the old Bonton was, is a large center. It has many openings and appointments available for vaccines, where you can also do walk-in appointments there.
And I would like to add too that all of these vaccines, they're highly effective, you know, in clinical trials among people of all ages, sex, and races. All the vaccines have been highly effective in preventing hospitalizations. For the most part, the Pfizer is approximately 94% effective. The Moderna was about a 94 to 95% effectiveness in preventing hospitalizations.
So that brings up a question that's not on your list here, but I'm one of the people that have the J&J, and I got it through the Berks Community Health Center. That has a less effective rate. I'd like you to just touch on two important aspects. One, that even at the 70-some% rate, it's far more effective than the effectiveness of most of the flu vaccines that are out there. And my understanding is, when I read the information on it, that it has some other benefits, not the least of which is one shot.
Yeah, and with the Johnson & Johnson vaccine, the biggest point to remember is that you want to prevent hospitalizations, and it has about a 93% effectiveness in preventing severe illness and severe hospitalizations. And I can say that, you know, I've had several patients that have had COVID, and, you know, it was right in the beginning of the pandemic, and I had a patient that went from calling us and saying, I don't feel good, to literally 4 hours later being hospitalized in the intensive care unit on a ventilator and being severely ill for weeks. I was concerned that he was even going to live. And for me, being in healthcare for over 20 years, it shook me that this coronavirus could really, you know, cause such a quick, severe illness in my patient. And so that really touched me, and it really kind of brought it home for me, because, like I said, it was the beginning of the pandemic, and we didn't have a lot of information about the coronavirus. I actually remember going home, and I called my daughter, who lives on the West Coast, and I said to her, please take all the preventative measures that they're telling you. Please mask and social distance, because this is a very serious virus. So I would say whatever vaccine that you choose, they're all going to really focus on preventing serious illness.
Thank you. I want to open up to anyone. Just kind of raise your hand. I'll recognize you. If you've gotten the vaccine, I'd like you to share, why did you get it? Would you also recommend others to get the vaccine? And if so, why? Who wants to jump in? So I'm going to go with Pastor Delphine Allen first.
Yes, thank you so much. The reason why I took the vaccine and why I have been encouraging others is because I feel it is so very important to us being able to get back to a sense of, quote, normal life. And in addition to that, for us to deal with something that was not just a local or a state problem, but a worldwide problem. And so having had past experience with, when we first started, I worked with an organization that was very closely related to the CDC. When we had the HIV/AIDS, I was very aware of the signs of the importance of this before it started really getting out into the public. And so I would definitely encourage anyone listening to us, watching us today, to please, if you've not had the vaccines, there's lots of education out here, lots of facts. And if you study it, then you will find that you're making the best decision for not just you, but for your entire family. Like, for instance, for us, we had a grandson that was born on the 28th of March, which was right after we had gone into full. And so it magnified the importance of us getting the shot for ourselves. But I've also encouraged my children. My son lives here, but our daughter's in Ohio, to do it too, because it's just the right thing for us to do as human beings in order to handle this pandemic.
Thank you. Erin Cherico?
So I was lucky enough to get the Moderna vaccine, and when the opportunity came up, I was at home and our schedules opened up at work to sign up for the vaccine. And to tell you that I jumped is an understatement. I signed up for that vaccine as quickly as I could because I felt like without that vaccine, I was walking around every day with just an unknown as to whether or not I was going to get COVID and unknown how it was going to affect me. Watching all the devastation in families around me was just not something I wanted to experience in my own family. So I quickly signed up for the vaccine, got it for myself. And as soon as I could, I made sure my entire family was vaccinated. I personally vaccinated my husband, my stepson, my daughter, and my mother-in-law, but also made sure that my father-in-law and my other children were also vaccinated. There is one person in my family who is not vaccinated, and that's my 10-year-old son. And if this vaccine is approved down to 10, he will be the first child in line to get the vaccine because I know that they're safe, I know they're effective, and more than anything in the world, I need to protect him from things like the coronavirus because I've just seen too much devastation in other families.
And Erin, I really appreciate you sharing how you went right to your family. So you're a medical professional, you're in the industry, you understand it, but for those people out there that said, you know, I think it's dangerous. If you thought that there was any serious risk, the last people you would want to push this on would be your family.
I never would have injected my own family with something that I thought was dangerous. You know, my daughter's vaccination was actually almost a last minute realization that I could get her vaccinated because she is under 18, so she could only get the Pfizer, and I just happened to be somewhere where she'd get a Pfizer, and I called her and said, get up here and get up here now to get and she did. She jumped in the car and she came right away. I never would have done that if I thought it was going to cause her harm. I did that because I wanted to make sure that she was safe.
Great. Anyone else want to answer that you've had the vaccine? Dr. Joy and then Dr. Camacho. Dr. Joy.
I actually had COVID back in October, and I was fortunate that I did not have a severe illness that required me to be hospitalized, but I can tell you the 2 weeks that I endured at home with all the symptoms, and I think I got every one of them, was certainly not pleasant. It was taxing on me physically, mentally, but it was also taxing on my children and my family because I was isolated to one room. They had very limited contact with me, and then also like the fear of something more serious yet to come because I had seen cases that did not go well. So with that thought in my mind and this possibility of I knew I had some immunity for a short term of time, but I did not know, and we do not know how long that immunity would last. So the thought of getting the virus again and perhaps having it worse the next time and not the fear of the unknown certainly prompted me to get the vaccine when it was available to me. Furthermore, you know, I wanted to be able to protect my family, protect my patients, and the community as a whole. And we know that the more people that get vaccinated, we've heard the word herd immunity probably floating around a lot, that the more people get vaccinated, the higher the probability of herd immunity, so that we can stop the virus from replicating. So if it comes to me and I'm now vaccinated, perhaps now it will stop and I won't spread it to somebody else. So we know it'll help with preventing hospitalizations, but we think it'll also help with preventing the spread. So those are the reasons why I got vaccinated. And I just this past weekend got my 2 younger children, ages 13 and 15, vaccinated. And of course, I would not, dare get them vaccinated if I didn't believe if it was safe.
Absolutely. Reverend Camacho.
Yeah, back in December, I got the virus, and together with me, it was my wife also, and my mother. My mother is 83 years old. She suffers from dementia, so she doesn't know how to express, no idea what's going on her. So the fact that she was 83 and the fact that she suffered from dementia was of a heavy concern for us and also for our doctor, family doctor, because her age and her condition, and besides that, she's also diabetic. My wife, who has who suffered from a neurological condition, also get the virus. And the virus, I saw how the virus really hit hard on my wife, to the point where we were afraid on a couple occasions that we had to rush her to the hospital. Thankfully, that wasn't the case, but it was a very close call. So we went through, as a family, what the virus really can do and the effects of. Besides that, I have my son-in-law, who sadly and unfortunately during this pandemic, he was diagnosed with leukemia too. And during that time, he was in the midst of the chemo treatment and everything. So his immune system was very low. And here I am, I had to take care of my grandson, as my daughter had to go to work. And sometimes I had to carry on my son-in-law to the hospital to check on his white cells and so on. So that was one thing. But then the other thing, as being a pastor and being so involved with the religious, with the community, especially the Latino community, I heard so many comments, and not just comments, but also comments that were made it on a way of a statement, like this is the final thing. And one of the things that sadly and unfortunately we live and we experience, culturally speaking, in the Latino community, is that we live with so many expectations and so many perspectives. And expectations on the fact that, we got a strong belief that something is going to happen, especially when it's expressed in a very negative, with negative connotations and negative meanings. So I heard from some pastors that were so influential, telling the parishioners, don't get the vaccine because this is what is going to happen. This is something that has been made by the government. So many things. So those two things, to be in short, led me to realize that, listen, if I want to communicate to my own Latino community, especially on the religious dimension, I had to set up the sample. It is a step of faith and because being in the army, going out twice to Afghanistan, my first tour, I remember when I was told you had to get 10 shots, 5, and had to be made it right now, not in the intervals of a couple of days. So, and I remember when I was told nothing is granted, but you had to, if you want to go out and you want to be with your soldier. So it was a step of faith, and faith believing that those who really put together the vaccines at that time were people who really knew, and were people also that had the high interest and high priority of taking care of us as soldiers. So it's the same thing today with our doctors and our scientists that are out there looking how it is that we can hold and control this pandemic and this virus. And very diligently and with all giving everything that they have come forward. And today we have 3 strong vaccines. So in an act of faith, I had to believe that what they're doing and they had done is something that they're doing it with the most sincere and honest interest in protecting our population and making possible that no more we will see friends or relatives, unfortunately, suffering and dying from this virus.
Yeah, absolutely. I'll come to you in a minute, Eby, but Pastor Eby, but Reverend Camacho, one of the things that we saw, at least relative to deaths, that next in Berks County, next to Caucasian, the next most hard hit ethnic community is the Latino community. I know that's not necessarily true in other parts. Many areas, the African American community was hit hard, but here in Berks County, the commissioners from day one saw every one of the death certificates of the confirmed COVID cases. And that's one of the things early on that really jumped out at me, that the Latino community was hit hard. And it's one of the reasons, to the credit of Commissioner Rivera, I know you've been involved, and others in the Latino community, the Hispanic Center, early on reached out to the Latino community on taking steps to protect yourself. So thank you very much for sharing your experience and your story.
And I just want to say,
yeah, go ahead.
Just to finish that, I'm not just the only one. Even today, my mom, who is 83 and who, you know, like I said, suffered from, we got the first shot for her. And even my wife, who suffered from that neurological condition, she also got the first one. And next in line is going to be my daughter. So.
Excellent. Great to hear that. Pastor Eby.
Yes, sir. Thank you very much, Commissioner. So I think for me, one of the key things I'm hearing is the risk factor, right? I think when you come to the point where it's riskier not to get the vaccine it's riskier not to get the vaccine than to get it. I think that's where the change of hearts begin to happen for a lot of people. And for someone like me who like Pastor Dell and Reverend Camacho, we're in the religious community, we hear a lot of conspiracy, a lot of speculations, and a lot of fear. One of the things that we try to do for us, the pastors at our church, when we got our vaccines, we took pictures and posted it on Facebook and Instagram, encouraging our people to go get the shot. What we're basically saying, we were setting a precedent that says we feel that it's safe enough for you to get it. That's why we have gotten it and setting the example for you to go get it. So I think that the key factor here is what is at stake for you. For me, you know, like Pastor Dell mentioned, she has a young grandson. I have 2 kids. And I have a wife who has a heart condition. So for me, at that moment, it's riskier to not get the vaccine than it is to get it, because I want to protect my family. And beyond that, as a Christian, it is my moral responsibility to protect the people around me. I'm sure it's the same for any person in any religious circle. It's your moral responsibility. It's your moral privilege and your moral responsibility. You've been tasked with to treat others as you want to be treated. I'm sure each of us will want to feel safe, will want to feel protected as much as possible. And getting this vaccine is one step towards that. Additionally, people really want to get back to whatever the new normalcy is going to be. Mm-hmm. And for us, we hear that a lot at church. You know, we want to come back. We want to take up this mask and sing and praise God as we did pre-COVID. And we all want that. You know, I can speak on behalf of almost every church in Berks, Canada. So we all want that. But for us to get to that point, each of us need to do our parts to get to at least the 70%. Then we can do whatever we want to do. If you want to have a grand mask dumping, whatever. We can do whatever we can do to celebrate that. But until then, we each need to do our parts to get to that mark. So I will encourage, whosoever is thinking about it, is still debating it. For me, one of the things I would say, what is at stake? If you have anything at stake, which we all do, even if it's not your immediate family, your community is at stake. There are a lot of people that depend on you and depend on you getting your shots.
So we're going to stay with you, Doctor. Yeah, I've got doctors and pastors and reverends. Pastor Eby.
Yes.
I saw the list that you had sent maybe a week or so ago to Barbara Lopez, Commissioner Rivera's executive assistant, listing a lot of the reasons people have vaccine hesitancy based on your experience. And I'm going to give others a chance to answer this, but I'd like you to share some of those core reasons that you've heard and understand why people say, no, I'm not getting the vaccine.
Yeah, so for me, it boils down to, if I can boil it down to perhaps 4 things. The first is time. One of the feedbacks I've gotten from people, because I try to do one-on-one and public encouragement as much as possible. I think a lot of people fear that the time that this vaccine has been out is very short, and as a result, I'm not willing to be kind of first in line, because they want to see how it's playing out. It's just like in any product. You have your early adapters, and you have your majority, and you have what we call the laggers or the late adapter. I think we've seen the early adapters. Almost everyone here that have had the shots, we will probably be considered your early adapters, and that's usually around generally it's around your 13 to 14%, and you have your big 70%, that is your majority, that comes over time. If you can remember back to when the smartphone came out, a lot of people were hesitant about getting the smartphone. Some people, maybe about 5-10% of the population, automatically jumped on it, but most people were like, I just need a phone to call and text. Not until they have grandkids, and their grandkids are out there in California, and their kids are saying, "Hey, mom, I can send you a picture of your grandkid. Hey, mom, you can see your grandkid real time." Then we see this massive movement of people, started getting the smartphones. So now maybe a majority of the population have smartphones, but that takes time. And I think part of what we need to do is to assure people that, even though it's relatively expedited compared to what we've been told in the past, that real work was put into this, that a lot of research has been put into this, that this, time or no time, this actually works because of the trials and the research that have been put into this. And the second thing, like I said, is the risk factor. People have not considered what is at risk, and one of the feedback to that is, well, I cannot put myself at risk to protect someone else, and that's something I've heard almost verbatim from a lot of people. And I think that's something for us in the religious community is us reminding people, you have a moral and spiritual responsibility to care for your neighbors like you would care for yourself. And the third, which I think is huge in Berks County particularly, and I think that could be a microcosm of what's happening around the country, is fear. There's a lot of fear, especially in the Black community, in the Latinx community, because of past experiences. So I was born and raised in Africa, and Africans have been vaccines have been tested upon Africans that should have never been tested upon Africans. So that created a lot of fear, and I hear that a lot among Black and brown colleagues, And I think they're just afraid. They're afraid of what the outcome of this vaccine could be. And again, there is where a lot of what this panel is doing. We're basically reassuring people that we have given this to our families. We've given this to our loved ones. And we, more than anything else, love the people that we've given this to more than anything on earth. So if we have done this, that's because we trust that these vaccines are good. And I think all of us not only need to play our part to get the shot, but we need to play our parts to mitigate the fear that other people are spreading, whether through conspiracies or through social media or news network. I think we all should do our part, whether you're in the medical community or you're in the spiritual community, to try to minimize that. And the fourth is trust. I think it was Commissioner Rivera that highlighted that people, there's a lack of trust for elected officials, and that has been happening for a while. So that trust factor is also a big part why people, in my experience, are hesitant to get the shots.
Absolutely. Thank you. Who else would like to jump in on reasons? Jeannie.
I can say I'm having some trouble with women of reproductive age, childbearing age, have vaccine hesitancy. And it's unfortunate because I think maybe it's social media or the news feeds that they're getting, and they're just really not accurate sources of information. And what I try to explain to them is that the vaccines it's a messenger RNA, and it does not even touch your DNA at all. It doesn't enter the cell. It doesn't make any genetic changes in your body. So what I do when I have patients in the room is I just try to educate them the best I can. But the biggest group, I would say just overall for me, would be the women in reproductive years. And I will say in the beginning, I'm like Aaron and Dr. Joy. I rushed to get the vaccine. I felt like somebody was giving me a Christmas present. I was just elated. I felt free. It makes you just feel free. And I got my entire family vaccinated as well. So it's just like what everyone is saying. It's like I wouldn't give my family and trust a vaccine to myself or my family, if I didn't think that it was safe. And I know it's scary because it's something that's new. So when, like you say, it's just the newness of it. And I will have some patients say, well, I'll do it in about a year. So I just try to educate them the best that I can.
And related to this, and it really, if you looked at your questions 3, 4, and 5 all really deal with this same area. One of the things I've run into is people's experience with COVID can be dramatically different. I will share my son got COVID and his wife got it. My son, neither of them were hospitalized, but our son had maybe 3 days where he was really knocked down and really feeling it. His wife got it and it was minor. And I hear from so many people, this is nothing. I maybe this is more medical, but I continue to believe myself that we don't know a lot yet about COVID-19, and that different people react differently to COVID-19. Some people, it's almost no reaction. We have one of our staff on the call right now that didn't even know he had it. And because of somebody else's experience, a couple months later, he decided to get tested and he had the antibodies, which he found out he had it. Can you talk a little bit about how that impacts people's thinking that this just really isn't a big deal? Aaron.
I think that is really one of the problems that we do experience, is that people are experiencing such different views of COVID. Like I can sit here and say, my family's done great during COVID. Nobody's gotten it. We've all been healthy. This is wonderful. But as soon as I walk outside my little family circle, I unfortunately know a lot of people very close to me who've had very different outcomes. I have a close friend who lost his father. My husband has a woman he went to school with who lives right down the street from his parents. She lost her mom and dad within a week of each other. My best friend from high school, her husband passed away, and shortly after that, his twin brother was in the ICU. So I think some of it comes down to what they've experienced, what you experience, what you see. I have a close friend who was very sick with COVID, and for a while afterwards still struggled with breathing, and I really even think to some degree some post-traumatic stress disorder, because she was very afraid of getting it again because she was so sick. She was so afraid it was going to get even worse than it did, and she had gone to the emergency room a couple times and being afraid of what it was going to do next time if she got it. And I really think it even caused her anxiety. And I know when she looks at other people who aren't as afraid of COVID or aren't looking at the vaccine, it's hard for her to understand why they're not worried like she's been worried. And it's because the experiences have been so different. And you hear people say, well, I know somebody with COVID, but they were fine. And it's hard for people to understand that one virus can make one person have no symptoms and take another person and kill them within days, because that's nothing we've ever seen before. So I think it's really hard for people to wrap their heads around that this virus goes from nothing to everything, and we don't have an explanation of who's going to get hit hard, who's going to be a very mild case, and what to expect. We really still don't have good answers for a lot of it.
So, and I'm going to ask anyone, do you think that maybe one of the challenges we face is that both elected officials and even some of the major spokespeople at the national and even state level have acted like we know exactly what's going on, and the reality is most of us know we're learning, and the general public, I think, loses confidence when they're continually told one thing, then it changes, then they're told another thing, and there's no admission. I see Pastor Delphine, your hand, and then Reverend Camacho. Pastor Delphine.
Yes, thank you so much. You know, John Maxwell says that leadership is influence, nothing more or nothing less. I think what we're finding here is that we've had a lack of leadership in this area when it comes to people being able to say, we don't know, and we're going to go based on this, or we do know, and we're going to have some responsibility for what we do know. So it's been a real-time thing where we're learning as we go. And the unfortunate thing about that is that people depend on someone to tell them what's the next step. So what we've seen happen is because of social media, because of other accesses to information, like when have we ever had a time in our society where our experience for a medical condition was more important than what the doctors were telling us about the medical condition? So I think that it's been a wave of things that have contributed to it. And I would think that the greatest thing was all the mixed messaging that people have gotten, so they didn't know who to trust and who not to trust at a certain period of time. For instance, I've talked to a lot of people in our congregation and in the community, and early on, their private doctors were telling them that they shouldn't get the vaccine. And so I'm not questioning what the private doctors told them. It's just unfortunate that they have not revisited that information since that meeting, which was over 12 months ago. So a lot of it has been that miscommunication. Back then, we didn't know anything about the vaccines. We didn't know how soon we would get them. But once they came on board, then people started trusting other means. And I think that has caused some of the difficulty, and not having a spokesperson. I remember when years and years ago, and I'll date myself with this, we had what they call drug czars. You know, this was the people that they were the spokesperson. People listened to them, but we've lost that sense of having those spokespeople who can really come out and say, this is what's going on and this is where we need to go.
Yeah, I would like to also to add, for example, in reference to our own Latino/Hispanic community, it's and reinforcing some of the things that you had say about miscommunication and mismessaging. For example, I have heard from the beginning that the vaccines are going to be offered free, out of cost to any one of the constituents. However, and that you just had to put yourself, make the appointment, and show with the code that they sometimes they give you. But my experience and the experience of my family and the experience of some of my friends, when we go, for example, in my case, when I went to the center, which was in Lancaster, so I had to drive all the way to Lancaster for Penn State, was as soon as I got there, they asked my name and an ID, so I gave my ID, but immediately they asked for insurance, for copy of my insurance cards. And when I told them, I said, well, I don't, because I have TRICARE, which is with the Army, and the Army doesn't give you any insurance ID. So it's just a matter of looking in the system. So when I asked them, why are you asking me for insurance proof? The person on the other side didn't answer my question. So that's one thing that's I heard from my own Latino/Hispanic community. That's and also the problem is that has been spread all around to others, saying, hey, be careful, if you don't have insurance, don't go, because they're not going to give it to you. Oh, but it's for free. Well, that's what they said on the news. That's what they share in the news. But however, they're going to ask you insurance, and then they're going to charge you insurance. So that's one thing. The other thing is I deal a lot with the undocumented community, with the migrant community, where there is a lot of undocumented people. One of the things that they're so afraid is when they ask for an ID. And that information is going to be taken, and that information is going to be referred to the federal government. It's the fear that is out there that's our own people. So one of the things that I believe is that when whoever is out there communicating and encouraging, they really had to know the community that they had to, and they're looking to address. Yeah, sometimes we had to look, and we can take everything in general, but in a case like this, especially when we see that there is a community that unfortunately is not coming forward, be the Black community or African American community, Latino or Hispanic, we had to look at, because one of the things that we had also to know is, for example, in the Latino Hispanic community, we know about history too. Yeah, a lot of people have the perception and concession that we are not educated, and that we have been so miseducated. However, that's not the case, because I know what was done in Puerto Rico with our Puerto Rican woman back in the 40s. I have friends who are from South America that they also know what was done with the people, using the people just for proof, to prove and to taste, some of the vaccines. So historically speaking, our people also know about history. So when they're out there and looking for someone that doesn't identify with them, reaching them and telling them, oh, you have to, or you must to, we have to understand that trust is very critical, it's very essential, it's very meaningful. And if we want to see a community really coming forward, because in all honesty, it's me putting my life in your hands, trusting that whatever you're going to give it to me and you want to do it for me is 100, not 99%, is 100% safe. And so that's another thing, the stereotype or the stigma that is out there.
Aaron.
So I want to speak to the insurance real quick. I spend a lot of time at vaccine clinics giving vaccines, and they are absolutely 100% free. And so that if anybody's asking, well, then why are they asking for insurance? And that's simply because there might be some cases where the organization, the group, the pharmacy that's giving the vaccine might be able to bill towards the insurance a fee for the administration. That being said, if the insurance doesn't pay anything, it's totally fine. There's no fees sent to the customer. Nobody's ever going to bill the customer. It just gives them an opportunity to potentially recoup some of the costs that they may have coming out of their pocket. So it is 100% free. And I've also been lucky enough to work with the Olivet's Club, who's worked close with the Hispanic Center to vaccinate, all throughout Reading. And so a lot of the people we've been vaccinating, I'm sure, are undocumented, and I feel lucky to be able to vaccinate them because I'm glad that they came and that they trusted us and we could give them the vaccine because they're my patients. My children that come and see me, that's their parents, their grandparents, and I want them healthy because I love these kids and I love their families and I want them here. So I'm so glad that I've had the opportunity to vaccinate them. And I just hope that they know that the last thing that, we're looking to do is to get them in any sort of trouble. We really aren't. We just want to keep them safe and healthy and keep them here and do what we can for them.
Dr. Joy. You're muted.
Sorry about that. The word trust was brought up several times by different people on this call. And I think that there's trust on so many levels. There's trust with your federal government, your local government, your healthcare providers. And I just want to say, I think for those of us, myself, Jeannie, Aaron, when we're with our patients, we're of course with our patient, one patient at a time. And in those interactions, we're able to build that trust because people come back and see us over and over again. And I think the relationship that people may have with their providers is very, very important. So I would encourage people, if there is hesitancy, if there's things that you're reading that you're just not sure about, call your provider and talk to them. Make a visit, if it's time for your routine visits, talk about the vaccines. I know I'm speaking for Aaron and Jeannie. We try at all of our visits when they're here for routine follow-ups or even acute visits to ask them, have you gotten the COVID vaccine? And then if I sense some kind of hesitation, I will inquire further and we'll have a discussion about it. I won't force a vaccine down anyone's throat, but I would encourage them, but I'll try to give them the reasons why, just like we talked here today. And we talked about, this vaccine being new, but we know that the technology that's used that Jeannie was describing has been studied for a long period of time. And we also know that these vaccines have been now tested on tens of thousands of people in trials. And now we have more evidence as it's live about its effectiveness and safety. So I would encourage people, please, 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 if you have questions, if you're hesitant, if you're not trusting what you're hearing in social media or even the media, talk to people who may know a little bit more about it, the providers. These vaccine centers have professionals working there. They're very open to answering questions as well. So work with the relationships that you have already afforded and build on that trust that you have.
Yeah, and one thing I want to highlight, the Berks Cares Vaccine Center, which we've partnered with Berks Community Health Center. We do not require people to provide insurance in order to get a vaccine. That we worked from day one to make that as open and as available as possible. We appreciate BCHC's participation. We've been on not quite an hour, and I want to give everyone an opportunity to kind of give your closing thoughts. What would you like people to remember from this program that you had to say to them? And I know that the commissioners, all three of us, from day one, and while you think about your closing, I want to just share a closing. We made a commitment. This wasn't going to be about politics. This wasn't going to be about guessing. I like this idea. We've worked from day one to work with data, That's why we put together a health advisory panel very early on in this process to advise us. We wanted to get our information from reliable sources. And I want to compliment Commissioner Barnhart and Commissioner Rivera. I know it hasn't been easy for any of us. We've gotten our share of being beat up by people that think we've overreacted to the virus, and other people think we haven't done enough, and it's a challenge. But I'd like each of you, and I'm going to start here as I see you on the screen. So I'm going to start with Reverend Camacho. Just in some closing thoughts, what would you like the people that are listening now and people that will be listening to remember? What's your message for the public?
My message to the public is that I really sincerely and honestly want to encourage my Latino Hispanic community and the community beyond the Latino Hispanic community to really try to do whatever is possible to get the vaccine. It is worthy. Yesterday, I felt safe as I was using the mask. Today, if that will be helpful, I feel more than just singly safe. I feel double safe because I had the vaccine. And it's also like Pastor said, it's a moral duty. It's a moral responsibility. It's not just taking care of myself, but also taking care of those that we love, those that we are in a day-by-day contact and relationship with, physically speaking. Those that sometimes, indirectly or directly are close to us or come to be in contact with us. So please, we have to trust those who really put their life 24/7 for so many days and so many months, working hardly, sacrificing the time, sacrificing their own families in looking to put together these vaccines for the goodness of all of us, not just in Berks County, but around the country. So please take the time, go there. To my friends and co-workers and pastors that are out there that have a church, a local parish, please, from the pulpit, encourage your parishioners to look at and also to go. But I call you and I challenge you to be the first one in coming forward and putting the vaccine and getting the vaccine and show it either by via of a photo or via of Facebook. Show it so your parishioners can see. Sometimes as we see, we'll believe and we come to trust. But to everyone there, please get the vaccine. You are not going to regret it. You're going to really highly appreciate the fact of getting the vaccine.
So before I go to the next person, one question did come in. I already said yes, but you, I think, Dr. Joy could address this best. If you get the vaccine, you can still get COVID-19. What's the value of the vaccine if you can still get COVID-19?
I think we spoke to this a little bit before.
Yeah.
The vaccines are not 100% effective.
Right.
So there's still that, small chance that you could get COVID. However, you could get COVID and not get sick at all. And it prevents hospitalizations and death, we know. So you might not even know that you got COVID because you've been vaccinated, your immune system's going to work.
It's not reacting. Hold on.
Oh, we hear you now.
Okay, I was having problems with my screen not reacting. Pastor Delphine, your closing comments. You're muted.
I would just like to say, I want to speak to those who, is it still muted?
No, you're good. You're good.
Okay. I would just like to say to those who are saying that you're going to get the vaccine maybe in a month, 2-3 months later. Let me speak to you. The vaccines are really important. I totally believe in them. I am so grateful that we have this technology available to us, that we have healthcare officials who care enough to spend their lives dedicated to researching. And I had the privilege of working at a hospital as a medical librarian early in my career. And I got to interface day in day with these people who sleep sometimes in the labs to make sure that they can discover everything. So let me say to you, instead of waiting, this is so critical for us getting to the 70%. If we can get to the 70%, we don't have to have the discussions in this state about whether we should or should not wear masks. We don't have to be concerned about the mixed messaging, the confusion that may be coming from the CDC officials. So 70% is the goal. I think we put up a number of 56,000 people here in this state that still need to get the vaccine in this county. I believe I want to be accurate in this county. So let me speak to that 56,000. I want to encourage you as a faith-based person who gets to walk with you when your children are born and who get to be with you when you die, with the family members who die and the tears. Let's do this now and not have the regrets of saying, I wish I had. So do it now. And I'm going to encourage you the way I did it when I went in. Do it afraid. Yes, of course, anything that we have put into our bodies, there's a possibility that it may not respond the way that we want it to. But we have medical people who are there, who are willing to stay with us, to do everything that we can. And as a faith-based person, I would say pray and ask God to help you with this. But now is the time. It's time to stop talking about this. We have been in this for 1.5 years. It's time for it to be over. And the only way it ends is with each one of us as an individual making a decision. And let me say this, I want to instill a little fear here because it's important sometimes. This will not be the only pandemic that we're dealing with. The sooner we deal with this one, the sooner we can get those people on to dealing with the next things that will be coming down. So thank you so much for this opportunity. And I'm available if anyone wants to reach out to me and have a conversation. I've spent the last 1.5 years studying about COVID, talking to people about it, looking at the research, having dialogues, and I will listen and I will give you the answers that I know and point you in the best directions to find this information if you need that kind of help. Thank you.
Thank you very much, Pastor. Aaron Cherico.
So I'm going to primarily speak to the pediatric population since that is where my specialty lies. And what I want to reassure parents is that this is a safe vaccine. I have vaccinated my own children. I'm eager for the day that I can vaccinate my 10-year-old. He may not be quite as eager because he doesn't like shots. However, he will be there the moment he can get that vaccine, and he will be getting it. Because at the end of the day, it's not even just about protecting the adults. Even the kids we're starting to get COVID. We're seeing more and more of them getting positive results and having issues from COVID with the multi-inflammatory system issues. So I just really encourage you to look at your children and remember how important they are to you, and that these vaccines are very safe, that you may very well be saving their life, saving their future, and protecting them with the vaccine also protects the other people around them. It gets them back into school. And I'm telling you, they are never going to complain about being out of school again. Patient after patient after patient wants to go back to school. They are not going to complain about being home like they used to. They now know how much they love school. So go ahead, take your children out, get them vaccinated. 12 and over can get the Pfizer vaccine. So there is a vaccine for them. It's a 2-dose series, 3 weeks apart. You can get it at the Berks Cares Vaccine Center. They do have the Pfizer vaccine there. If that doesn't work for you, you may see me. I'm often at weekends working with the Olivets Club and Oakside Care Pharmacy, giving the Pfizer vaccine at different locations throughout Reading. And I'm giving it to the kids because I care about them. I want them to be safe. And I truly love my patients, and there's no way I would do anything to hurt any of them. So I just really encourage you guys to consider vaccinating your babies.
I think Commissioner Leinbach may have dropped off here. Who has not given their words?
Go ahead, Michael.
Everyone done?
Yeah.
No, okay, go ahead.
I think it was Dr. Joy that was supposed to go next. And then
I'll go after.
Yeah, I can go last.
Go ahead, Dr. Joy.
That's fine. I think I'm going to echo what everyone else said, but it does take each of us individually to stop this pandemic. I encourage everyone to please get their vaccines as soon as possible. We had been waiting for the time where the availability, the abundant availability would be around. I remember just maybe a few weeks ago, we were still, trying to find appointments and things like that, but now we have availability in multiple places. So there's no reason to say I can't get it till next week or 3 weeks, because you could probably get it this week. You may even be able to get it today. At some places you could go in and walk in and get it today. But to be able to stop this pandemic, to have life as it used to be, it takes each of us to please to get the vaccine. It's not just us as adults that have been suffering from this for the last year plus. Our children have been suffering. They haven't been able to go to school or participate in activities. And we know the mental health strain that it has taken on our families and our children. So the sooner more and more of us can get vaccinated, we will be protecting those who cannot get the vaccine. Perhaps right now, those under the age of 10, and there may be other individuals for other reasons that cannot get that vaccine. So it is our responsibility to take care of each other as community members to get the vaccine. So I would say again what I said earlier, please talk to your pastors who have information, your healthcare providers who have information. If you have questions, if you have doubts, get them clarified, and then get your vaccine. It's not going to be, for some people there are no reactions. I could tell you both my parents had got it and they had different reactions. I had a more severe reaction than perhaps they did. So everyone reacts a little bit differently to the vaccine. However, that is temporary. It's a finite period of time. It's more predictable than what may come with having COVID. We know more and more as more people have COVID, we are seeing more lasting effects. The long COVID effects are happening. I have patients who continue to have trouble breathing, continue to not smell, long-term effects of COVID. So we want to try to not have those things happen. And also, though, then we as your primary care providers, we can focus on the other health problems that may have lost some focus over this year and a half, like your chronic health problems. So please take care of yourself. This is one of the basic health promotion preventative steps that we can take, just like other vaccines that we promote throughout our lives.
And then just to sum everything up, overall, I would just say the benefits of getting the COVID vaccine outweigh the risks of getting COVID. It's lost time at work, and like Dr. Joy said, I've had patients that had COVID months ago and are still suffering from symptoms. So just overall summing it up, the benefits of getting the COVID vaccine far outweigh the risks of getting COVID, possibly being hospitalized and having severe complications. So thank you for your time, everybody.
Thank you very much. Did Pastor Eby speak yet?
Not yet.
Yeah. Okay, you go ahead. You'll be. I think you're the last one. Then I apologize. I was getting kicked off. I may get kicked off again, but go ahead, Pastor Eby.
That's okay. So thank you first. I want to thank you and your colleagues and your team for creating this platform and giving us a voice to share. I think a lot of people need to hear this. For me, I like to speak directly to two communities, the religious communities and the young families, because I'm one of you. I belong to a religious community, and I'm also, I have a young family. Three things I would say to the leaders first. I would say lead by example. As leaders in our respective communities, people look up to us, people listen to us, and Reverend Camacho said it clearly when he said that it's part of our moral responsibility.
Mhm.
So I want to plead with every leader out there: set the example for your people to follow. It's so critical that it starts with you. Everything rises and falls on leadership. Lives are at stake, and a lot of people depend on that. As a pastor, we've buried enough people from COVID. I've had to cancel a lot of family who've lost loved ones from COVID. I've had to do a lot of family counseling because of the psychological, mental, social effect from COVID. I think we all can say in our own respective field that we've had enough of this, and we would like to move on. But we cannot do that until we've all played our part. So that's the first thing. And the second part, in order to gain trust, to mitigate the risk, and to overcome fear, I think we need to speak with the right people. Be careful where you get your sources from, your news. I would say speak with the experts, people who have done the research, people who have done the work, the medical professional who have put time and their lives at risk. Your religious leaders who have done a lot of work to give people the right information. Speak with the right people, because where you get your information is as critical as the information that you get. And thirdly, like I said, we just want to get back to hugging each other. We just want to get back to being in communities. I mean, it's almost the summer, July 4th. I'm looking forward to grilling. I'm fully vaccinated. I've got a few friends who are fully vaccinated. Just looking for us to get together, grill and just have a really good time. People miss that. I mentioned earlier, I have a 2-year-old son who has been home with us for most of his 2-year-old life. And one of the things that my wife and I have noticed, he lacked social skills because he's not been interacting with other kids. And there are thousands, if not hundreds of thousands of kids like him. What effect will this have 5-10 years from now? Raising an entire generation that lack the social skill to interact with people their age. I think we can overcome that if we all begin to play our part, get the vaccine. We're about halfway there. We're about almost halfway to the 70% mark. If you know somebody who has not gotten their shot yet, without guilt or shame, have a conversation with them, help them get there, direct them to the right resources. If we all play our part, we can do this. There are precedents that have been set, countries and communities that are doing this. We can, but it will take each and every one of us to make it happen.
Thank you, Pastor Eby, and thank all of our panelists, Jeannie, Dr. Joy, Pastor Delphine, Aaron, Reverend Camacho, Pastor Eby. Thank you very much. You're the voice of the community, and that's what this program was all about today. I hope people that have tuned in and may tune in to rebroadcasts of this will find real value. I'm Commissioner Christian Leinbach on behalf of Commissioner Barnhart, Commissioner Rivera. Thank you for joining us.
Thank you.